A very good evening to all of you. Today we are going to see a case note of Mr. Samuel Caine, who is suffering with hepatitis B infection. He was under your care at Holy Angels Medical Center, where you are a charge nurse. And you are writing a referral letter to Dr. Aldrin Raybird, who is a hepatologist at Spring Dawn Hospital following the discharge of Mr. Caine for further evaluation of his condition. So we understood the basic information. The patient name is Mr. Samuel Caine, a 22-year-old male patient who has hepatitis B infection. He is slowly recovering from this. Now he is discharged from Holy Angels Medical Center, where you are a charge nurse. As a charge nurse, you are writing a referral letter to Dr. Aldrin Raybird, a hepatologist at Spring Dawn Hospital, Riverbank Road, New South Wales, Australia, for further evaluation of Mr. Samuel Caine. Now let's go ahead and see what exactly the case is. Samuel Caine is a 22-year-old male patient. He was admitted on 2nd August 2014 with stomach pain, poor appetite, nausea, fatigue, mild fever of yellow skin or eyes. So that's what we have seen. We have some diagnostic tests performed. That is, the first one is ultrasound scan of the liver, and the second one is the antigen specific blood test, which confirmed that he has hepatitis B. So we have some explanation of the test there. The test is called hepatitis B blood panel test. So why we need to write this particular test, the explanation of the blood test, to a hepatologist? The hepatologist already knows what the test is, what are the components of the test, all the things he knows. We just need to inform that antigen specific test is done for this patient, which confirm his diagnosis. That's it. We just don't need to inform him what is this hepatitis B blood panel test and what all the components it has. So it is unnecessary to explain to a hepatologist who is a specialized doctor this particular thing. So we just need ultrasound and specific blood test, that's antigen specific blood test, diagnosis confirmed. So all this blah 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 is unnecessary. Now about the treatment, it's very important. We have the medicine here, Baraclude 0.5 mg once daily for 3 months. So the way of taking is not important here. Now, and the vitamin E, the vitamin supplement 300 mg. So the dosage and the medicine and the duration, you have to say. The mother of taking is not important there. So for the duration of 3 months, it is commenced. Baraclude 0.5 mg along with vitamin E 300 mg. So once and twice a day, respectively. So that's what we can say there. Now, when we have started the medicines, we have seen some complications there. Severe stomach pain, high fever. So we have given paracetamol 500 mg twice a day. So which improved his still the stomach pain still persists. So apart from that, he has no other complications prevailing. Now we have some other important things. We have advised in the discharge plan, we have to give education to Mr. Caine about reducing carbohydrates in diet, skipping the sweets, fruits and veggies, protein, lean meats, poultry, all these blah, blah, blah. And one important thing is no alcohol at all. Exercise thrice a week, at least 30 minutes. All these things are important there. We have to say, because as far as medicines are important, diet as well as dietary restriction is important. Now we can say that see a hepatologist for further evaluation. The other thing, prescriptions and vitamins, we continued for 3 months. We already mentioned earlier. So it's a repetition there. So Dr. Alder, hepatologist. Yes. Hepatologist. Yeah, no problem. Springtown Hospital, Riverbank, New South Wales, Australia. We have to have a space here. Yes. Reference Samuel Caine, aged 22. I'm writing to request further evaluation for Mr. Samuel Caine, who has been recovering from hepatitis B infection. He's been discharged today. No problem. Quiet, complete. It's completely okay. Simple, understandable. All the information is there in order. Mr. Caine was admitted to our care on 2nd of this month with mild fever, poor appetite, nausea, and yellowish discoloration of his skin and eyes. So we have said the symptoms here. He has undergone ultrasound scan of his liver and certain antigen-specific blood test, which confirmed his diagnosis. So we have not explained the test name and what its components are. We just said an antigen-specific blood test, which confirmed his diagnosis. So if you want to say that the specific blood test, this is the name of the specific blood test, then you can say no problem there. So as far as we just said certain antigen-specific blood test. Therefore, he was commenced on baraclude 0.5 mg and vitamin E 300 mg once and twice respectively daily for a duration of 3 months. Here we have said how he came, what investigations we done. Now, about the first line medications we prescribe and how long we have prescribed it. How Mr. Caine developed complications such as severe stomach pain and high-grade fever, for which he was prescribed with paracetamol and ibuprofen, 500 mg thrice a day. So even though we had started the medicines, he developed complications. What were the complications? We said severe stomach pain and high-grade fever. And what we gave is paracetamol and ibuprofen. Subsequently, his health status improved despite occasional stomach pain. Now, we said gradually he had improvement despite the persistence of occasional stomach pain, which occurs occasionally. At our center, he was encouraged to make positives. So I just need to cancel this here. He okay, on the basis of his discharge plan, he was encouraged to make positive lifestyle changes, including time-based regular exercise, including Regarding his diet, he was advised to have fruits, vegetables, and protein-rich foods, which includes eggs, nuts, milk, which includes meat, eggs, nuts, and milk. So that's it. So regarding his diet, he was advised to have fruits, vegetables, and protein-rich foods, which include meat, eggs, nuts, and milk. He was also alarmed against high carbohydrate intake, high carbohydrate sweet, and alcohol intake. So he was also alarmed against high carbohydrate, sweet, and alcohol. So we made some changes here. So there were some problems here, so we're just making some adjustments here to make it grammatically correct. Sorry. So we have mentioned almost all the things in very basic sentences. Almost it is, even though it is not tightly connected, and we have made things connected. It's not well connected still. We can connect it more tight, and we can improve our score accordingly. But as far as for the students who need to understand overall things which we need to include, it is there, and on an average, on a whole, it's connected well. So that's okay. So you can make it better. This is the basis. So according to your language proficiency, you can make it better. You can make it look more formal, but keep in mind that it should not look too formal. Okay, now we have the body here, and now we have the request paragraph. It would be appreciated if you could consult him and provide your expert advice in order to make his recovery smoother and less complicated. So I can't say that a faster recovery, because you know that this is hepatitis B and it takes at least 3 months to cure. So in order to bring him back to his normal life, it takes time. So I cannot make a faster recovery. There is no option here, but I can make his recovery smoother and less complicated. He should not develop complications, because we have seen some complications in between. So and we expect some complications in between. So we have to say that it should be less complicated and it should be smooth. That's what something which we have added here. We have not and assumed anything from here. We just made our own words there. That's it. It's consulting the patient and providing expert advice in order. That's further evaluation. So that's it. In case of any further queries concerning Mr. Caine, please do not hesitate to contact me. Yours sincerely, Charles Nurse, Holy Angels Medical Center. So that is the end of the letter. Hope we would be seeing soon with another letter. Till then, bye.